our webinar about the Knowledge Mobilization Partnership Program from CC ABHI. Thanks for choosing to spend your lunch hour listening to us go over the details of the program, and I hope we have a lot of interesting questions. We will be collecting questions along the way. You should notice that there's a control panel over on the right side of your screen where you can enter in those questions. We have somebody from the CC ABHI team reviewing those and maybe answering them for you in real time, but may also collect them for discussion at the end. Anything you stump us on, we'll take away, and also any questions that tread on new ground will be added to our FAQ. We have the whole lunch hour. I don't expect we will be taking the full hour. I'll quickly show you what we'll be covering in this program, this webinar today. So first we'll start with the basics, not assuming anything. What is CC ABHI? Who are we? Why do we have this program? And what do we hope to accomplish with it? We'll talk a little bit about the program itself and what we're looking to gather in terms of proposals. And we'll start with a very brief discussion of what we mean by knowledge mobilization as well. But it'll be useful both if you're completely new to the topic or if you're such a specialist that you're wondering if we're using mobilization to exclude other kinds of adoption or implementation activities. So we'll have a quick review of that. Then we'll get into some of the practical elements of applying, where you can find the application form, what will the process be, some of the key dates, and that kind of thing. And then that's where we'll end. We'll end on those key deadlines you should be looking for as we go into the program. As I say, if we don't cover the particular question you had in your mind when you tuned in today, then feel free to put that into the sidebar and we'll get back to you. So we'll start with what CC ABHI is. So we are a solution accelerator. As an organization, we're here to ensure that the solutions that address the key issues and problems facing the aging and brain health sector are addressed, that we can take those solutions and move them more quickly along the pipeline of development, customization, evaluation, and adoption. And we do that by funding projects that will help accomplish those steps. We have a number of programs. This was the Knowledge Mobilization Program was the last one we rolled out in our first full operational fiscal year. The ones we rolled out earlier were the Spark program. Each program has the same mission behind it of accelerating solutions for aging and brain health, but each one is targeted at a different community of innovators or a particular kind of barrier to adopting new innovations. So the first program we rolled out this year was the Spark program, from which we got over 30 successful applicants to get a grant of $50,000 to work on their early stage innovation. Those innovations were all driven by point of care service providers in healthcare organizations. So it's really a grassroots kind of program that had a lot of exciting outcomes from it. We've also rolled out the Industry Innovation Partnership Program, or I2P2 for short, which is aimed at vendors with innovative solutions that are mature and ready for a more robust evaluation in an operational setting. And that program takes those vendors and can match them up with potential trial partner sites that we also connect them with, and that program is at the shortlisting stage, and we look forward to reviewing those final applications in a few weeks. We also have rolled out the Researcher Clinician Partnership Program, codenamed Silo Buster, which is about bringing researchers and clinicians together in a substantive partnership to evaluate late-stage translational research and move them into helping patients and caregivers and other stakeholders, and that is still underway as well in terms of the evaluation. And then that brings us to our program today. So each one of those programs funds projects that will move that acceleration forward and get innovative solutions and practices to the bedside of patients more quickly. As I say, excellent segue into KMP2 itself. So Knowledge Mobilization Partnership Program. Here, the focus is, as the name would suggest, on knowledge mobilization, but I'll just take a second to unpack that concept a little bit, just so we're a little bit on the same page. So knowledge mobilization is associated with a number of activities and products that really focus on the dissemination and implementation of practices, products, or services. Anything that has strong evidence behind it as being superior to current practice or current approach to things. And as everyone who works in the healthcare industry knows, it's that adoption of the latest evidence-based approaches that really takes a long time. A lot of people argue that we should be only focusing on implementation science and maybe back off a little bit from the primary research. That's an extreme view, but it speaks to the fact that there's a lot of already proven superior approaches to doing to practicing health that are still in the queue, not being put into practice where they would be helping people. So our knowledge mobilization program is really about tackling that problem. So in terms of what we actually mean by it, knowledge mobilization in the most broad sense is really about the synthesis, the dissemination, the exchange, and the application, the careful, ethically sound application of knowledge to improve healthcare services and strengthen the healthcare system as a whole. It's about a number of activities that will qualify, and we'll go into what kind of projects, what kind of project activities we're actually looking to support in the coming months. But at its most base, it's about getting the right information to the right people in the right format at the right time so as to influence the decision making and practice on the ground. And it's really about supporting evidence-based decision making in the organization, management, and the delivery of health services. So it's getting the evidence incorporated into the way we practice. Evidence behind a guideline of practice or around a particular product that has superior outcomes and is not being applied broadly. So the partnership program itself has a number of characteristics to try and select projects that will achieve these ends. So we're seeking to drive adoption of the best and next practices, as the phrase goes, across stakeholder groups in the aging and brain health sector. So not about knowledge mobilization in the broadest sense, but really focusing it down on the priorities that CC ABHI is here to tackle. And I'll get more into that over the next few slides. So KMP2 projects will be involved in disseminating and implementing evidence-based practices, products, and services. They will engage older adults and their circle of care and their healthcare practitioners. So that triad that is supporting each other in the delivery of healthcare and the receiving of healthcare services. It will lead to improved health outcomes and quality of life for older adults and their caregivers. So these practices should be linked in the last little bit. So we're switching to another platform, another computer. Thank you for the seamless support from my team there. Just turning off the other speaker so I'm not driving myself crazy. Okay, so I'm going to repeat the content on this slide. Sorry if you got most of it. I'm not sure exactly where I cut out. So I was getting down to the details of the Knowledge Mobilization Partnership Program. So as the slide is. You've now had a few minutes to look at the slide. I may be repeating information you've both already heard and read a few times, but just to make sure, the program will the goal is to drive adoption of best and next practices across the stakeholder groups in aging and brain health sector. So to unpack that a little bit, what we mean is that the KMP2 projects they will be involved with disseminating and implementing evidence-based practice products and services. So getting that next and best practices into use. It will be focused on the stakeholders that are of priority to CC ABHI, which is older adults, their circle of care, and healthcare practitioners. And it should be linked to improving health outcomes and health system outcomes and quality of life outcomes for older adults and their caregivers. Very specifically to this program, $250,000 of funding per project, and the project should last up to 12 months. So some significant resources to achieve project outcomes. So what kinds of projects qualify? To get down to some more specifics in terms of the kinds of activities that would be supported in these projects. So the creation of knowledge products, or the creation of the tools and platforms that would be used to exchange or disseminate knowledge that would be achieving the goals just outlined. We would be enabling the support and integration of evidence-based guideline into practice. So a project that's focused on really implementing products or services that have that evidence behind them. And we're looking for something that would be beyond just one organization. So maybe you have something that's been proven in one or maybe two sites that you feel like is a program that's ready for scaling and spreading to a network of organizations or a region or a province or maybe even a nation. But we understand it's only $250,000 in 12 months, so there may be some practical limitations there. And then also activities around the evaluation of the effectiveness, both of the program, of the innovation itself, but also around the techniques, the strategies you use to do that implementation. How effective was it at achieving adoption? How effective was it at disseminating and spreading the knowledge? Another thing to point out that, like all of our programs, this one is constrained within the 4 priority areas that we've decided to target. So aging and brain health is already a pretty broad, it's already a target, but it's a pretty broad one. So we have 4 priority themes or areas or problems that has cut across all 4 of the programs we've rolled out. So this one is no different. So the first one is avoiding emergency department visits. So avoiding or reducing ED visits, especially for older adults living with dementia. Apologies, I'm just switching locations again because apparently the audio is cutting out. But hopefully the connectivity will be a little stronger here. Okay, sorry for the disruptions, everyone. So just to repeat what I was saying earlier, cutting across the 4, your project should not just address aging and brain health in general. It should touch on at least one of the 4 themes that we've decided to prioritize this year. The first one being ED visits, specifically avoiding or reducing the need to visit them for older adults living with dementia. Preventing falls or mitigating the injury due to falls. The ability to age at home or age in place, wherever that home happens to be. That would be both in the community or perhaps in a retirement residence or a long-term care home, but something that would allow the person to stay in their current residence of choice with the quality of life and safety required to do so. And finally, cognitive fitness. So these are solutions that would improve brain health and cognitive fitness in general. The first 3 are very much targeted at people living with dementia, and this last one is more generally for older adults to either avoid receiving dementia or to mitigate the effects of having dementia. Another thing to consider, and a lot of this is embedded into your application form, is but to really be clear about how you are going to measure and measure and evaluate your project. So this is important to understand the key performance indicators that will be coming out of your project. So what are the outputs? What will literally be coming out of your project in terms of the people you intend to reach, their number, the types, quality, how many sites will you be approaching, how do you define what a site is, what are the strategies, how will you be counting or quantifying each one of those strategies. So how many times will the strategy be employed, and it's the effectiveness of that strategy. And then, of course, just in general, how well is your program working? Is it being deployed as you saw it, as you foresaw? Is it sitting? Are you under budget? Are you on time? Is it appearing to be feasible, sustainable, scalable? And how will you measure those things along the way? The project outcomes are really about letting us describing how you're going to impact behavior or practice. So how effective are your mobilization strategies? How did you affect people's attitudes or knowledge? How did they change their practice or behavior? And then again, how will you be evaluating this? And then finally, how will you be connecting these changes in behavior to the larger scale impacts that they'll have in terms of the benefits to the recipients of the behavior change? What impact will this have on their quality of life, and what indicators are you tracking to show any effect that would be seen within the project timeline? Although many of these larger scale impacts would be beyond the time scale of the project itself. So explain that in terms of the timeline and what indicators you're going by to assess your success along the way.
Code gray, stage 1, water system. Please refrain from using water. Code gray, stage 1, water system. Please refrain from using water. Code gray, stage 1, water system. Please refrain from using water.
So just in case nobody got that, it's a code gray stage 1. That probably doesn't affect you where you are unless you happen to be in the building at Baycrest. Apologies. I've changed the location so many times. I'm now in a space where I'm not shielded from these kinds of interruptions. That's okay. I think we can all handle it. We're getting there. So finally, something to consider is that you'll be naming a host institution in your application. It's important to understand the role of that host institution and what you're signing them up for, and hopefully what they are signing up for. You will need to include a letter of support that says that they understand these responsibilities. So of course, one of the main things they'll be doing is receiving and administering the funding for your project, and will be responsible for overseeing your activities. Of course, we will engage into an agreement, a legal agreement with your host institution to supply you with the funds for your project, and then generally they should be supporting the infrastructure and the overhead for your project. There may be other organizations involved that may also be doing this, but your host institution it's mandatory that it does the first two things. And then in terms of where your action will be, the action for your project will be maybe other organizations may come into play in terms of providing you facilities. So they're also under their regulatory controls, and you will be working within those controls at their organization. And then organizations do not need to provide matching funds. Matching funds are welcome, whether that's in kind or in cash, but it's not mandatory. And the nonprofit organizations, on the other hand, without a charitable status, must provide at least 50% of the budget. They must provide matching funds, but this can be both in cash or in kind. Also, as I mentioned in the last slide, applicants can partner with other individuals from healthcare providers that are not the host organization, and these can include an even broader array of partners, whether they be academic institutions, third-party content providers, for-profit private organizations, and they can all work jointly as long as your host organization is one of those qualifying organizations. Um, okay, now we're really getting down to brass tacks, nuts and bolts. How do you apply? Well, there's a form you'll have to physically fill out, and that form is an online form. You can find it by going to our website. There's a big blue button that says apply for KMP2 funding. That button, and also a link within that web page. Sorry, all right. You hit that button, you'll be taken to a web page. It's a page that has all the information that was included in this webinar and some more of the fine print. There you'll find a link to the web form itself. The deadline is May 10th, and we will be letting the winners know of their fortunate status on June 30th. Okay, so here, so you can get there by going to ccabhi.com, follow the link to applying for KMP2, and you can get to the form. But if you don't have that kind of time and you need to get there directly, you can just type in the link you see before you. It's baycrest.blitzen.com/form/ and this is the code, easy to remember code, KMP2 2017. As you say, as I say, and as you say, May, after seeing this, you can go to the CC ABHI website and find it there as well. A few words about the form. I'm not going to walk through it in detail. It's an online form. You've seen those before. But some things to note about the form is you don't need to create an account and log in to access the form, but you're still able to save your work as you go. And it does that by, there's a button at the bottom of the form, and I would recommend you do this as soon as you start the actual form, that says save your work or save. And when you do that, what it does is it generates a unique URL or unique web link that is specifically for you and the data in your form, and it'll be saving as you go after that. So when you hit the save, it'll generate that unique URL. You can now bookmark it, you can cut and paste it and send it to yourself. There's also a button that says email me this link, and if you do any of those things, you'll have a link that will take you back to your form in progress. What's nice about that, as I said, is first, you don't have to create a user account to do that, so not another username and password to remember. And also, it's quite useful for sharing the form if you have a number of people filling it out with you. So you can take that URL, you can access your own form, fill out the data, and when it's time to pass the pen, so to speak, you can forward the URL to your partner, and they can continue to fill out the form. And either of you can hit submit when you're ready. The only word of caution I would say is that try not to have it open on two computers at the same time. I've seen that lead to trouble. And try not to have it on. Try to synchronize your work with the other person. It's not so robust that you can both be pounding data into it and hitting save and not expect some problems. So try and segment that work between yourselves. Finally, once you submit, how will we be evaluating it? I think in broad terms, these are the key evaluation criteria. So we'll be evaluating the need you're addressing. That's the sort of need that your innovation is linked to have impacts with. What problem is it solving, and what is the significance of that problem? Can you quantify how important it is? What kind of longer-term impacts disseminating this knowledge will have? What is the solution that you will be mobilizing? So what are you getting out into the world? Describe the nature of that new practice or new service or new solution, and how is it superior to current practice? What makes it more scalable, more beneficial than the current practice, and how can you quantify these things? The approach to knowledge mobilization, so how will you be disseminating this information? How will you be encouraging this implementation or adoption? And how is it scalable in terms of bringing it to beyond one or two locations? How will it scale and spread? How effective has it been proven to be? What's your project plan? So does your time, budget, resources all make sense? Does it seem feasible? Do you have all the resources in place to collect your metrics along the way? Have you thought things through end to end? And then finally, who's on your team? What organization do you work for? And what's your track record for doing these kinds of things with success and so kind of a resume CV requirement as well. Okay, big finish on the dates. So we announced recently, and now this is part of our own dissemination activities to get the program out to you. The deadline for your final application is the 10th of May. So you still have enough time to put your application together. Successful applications will be notified at the end of June. We're aiming to get these projects going by September, which would mean that in the time we'll have signed all our legal agreements, completed our charter, done all those startup activities so that we're ready to go and to flow the funds for you to get going. So you have now received the information in the webinar. It was in my head, and now it's in your head. That's how knowledge works, and that's what we're all about here for the Knowledge Mobilization Program. So if you have more questions, there's a few important points of contact. So ccabhi.com is that website I was referring to, where you can find the Knowledge Mobilization Program page. And you can also reach us at info@ccabhi.com. That's a general purpose email. Or reach out if you have questions about the program. Reach out if you have problems with the form. Reach out if you're not sure who to reach out to. And that's the end. I'll leave on this. So we have a few questions that have come in. So we've some people asked who can apply. So I think we addressed some of this in the presentation, but just to be clear, basically you need to be an employee of an eligible host organization. Host organizations do need to be in Canada. You can be charitable or nonprofit, but you have to be one of those two types of organizations, and also the charitable organizations don't need to submit matching funds. Nonprofit organizations do. And we also say you could be employed or affiliated with. That's a kind of formal affiliation. So if that's your situation, you should describe to us the form of your affiliation and provide some evidence of that. Knowledge mobilization. So it's funny. What is knowledge mobilization? Funny you should ask, because I just came back from a 3-day course on it, and I thought I knew what it was, but it's actually a hot topic. So what we mean is, in the very broad sense, addressing both implementation practice and dissemination practice, as well as the evaluation of those, the effectiveness of those things. So dissemination is really about the spread or the distribution of that information, getting it into the hands and heads of the people for whom it will make a difference. And then implementation is really more of a hands-on adoption exercise, a project that uses a number of techniques and strategies to get knowledge into practice. And our program addresses both those things, or those things in combination, as long as it fits within the time and scope of the program. Are there any fees to apply? That's a very practical question. So no, there is no fees to apply. You can apply just by accessing the form. And then what happens if your application is selected? That's another good question. Well, there is a formal onboarding process that you and your host organization will be brought through. I think the key item to keep in mind is that and it will become the basis for a formal agreement between us and your host organization. We'll also be formalizing the project charter and working with you on refining what KPIs will be coming out of your project. So those are the sort of the key onboarding elements. Okay, maybe we should quit while we were ahead. As I said, if we haven't addressed your question directly, if you haven't been able to get it answered either in the presentation or in this Q&A here, please reach out to me through the info@ccabhi.com. It'll get forwarded to me, and I'll get back to you with an answer to your question. And as they come in, we will flesh out the FAQ that's also available on our website, so that future generations will have that knowledge. Okay, thanks again. Again, I apologize for a few of the disruptions, both technical and water-based, that you may have experienced, and look forward to seeing your applications and to receive your questions. Thanks very much.